The coronary circulation refers to the arteries and veins that deliver blood to and from the myocardium for the function of nourishing the heart muscle tissue. The coronary arteries deliver blood to the myocardium. We will examine a few of these, beginning with the left coronary artery, which emerges from the aorta. It distributes blood to the left side of the heart, specifically the left atrium, the left ventricle, as well as the interventricular septum. The circumflex artery arises from the left coronary artery, so it's essentially one of the branches of the left coronary artery. It wraps around the heart, eventually fusing with the right coronary artery. The right coronary artery also emerges from the aorta, and it functions to deliver blood to the right side of the heart, specifically to the right atrium and the right ventricle. The anterior interventricular artery is the second major branch of the left coronary artery. It follows the interventricular septum on the anterior side of the heart. And finally, the posterior interventricular artery arises from the right coronary artery, so it's a major branch off of the right coronary artery, and it follows the interventricular septum on the posterior side of the heart. So figure 19.15 highlights the major vessels of coronary circulation. Here we will just focus on the coronary arteries for a moment. So from the aorta, both the right and the left coronary arteries emerge. The right coronary artery takes the path around the right side of the heart at the boundary between the right atrium and the right ventricle. The left coronary artery takes a path around the left side of the heart at the boundary between the left atrium and the left ventricle. The left coronary artery branches to become the circumflex artery and the anterior interventricular artery, with the circumflex artery continuing a similar path as the left coronary artery. The anterior interventricular artery takes a path between the right and left ventricles on the heart surface, and then on the posterior side, we see that the posterior interventricular artery takes a similar path between the right and left ventricles. The coronary veins deliver or return blood from the myocardium back to the right atrium. The small cardiac vein parallels the right coronary artery and drains blood from the posterior aspect of the right atrium and the posterior aspect of the right ventricle. The middle cardiac vein drains blood from the posterior interventricular septum. The great cardiac vein drains blood from the anterior interventricular septum. And then finally, we have the coronary sinus, which is a small chamber that receives blood from the small, middle, and great cardiac veins, and then drains or returns that blood to the right atrium. The small cardiac vein runs a path similar to the right coronary artery between the right atrium and the right ventricle. The middle cardiac vein traces the reverse path of the posterior interventricular artery, while the great cardiac vein traces the reverse path of the circumflex artery. And all three of these veins deliver blood to the coronary sinus, which will return that blood into the right atrium.